Right, so let's now speak to Principal Secretary in the Ministry of Health, Susan Mochache, who joins me live now. Thank you, Madam PS, for speaking with us. It's been a month and 4 days since we reported our first case. Could you give us your assessment of where we stand now with the fight against COVID-19?
Thank you very much, Yvonne, for having me. And certainly it has been just slightly over a month since COVID was reported. And we have seen some progressive steps that we have taken as a country and as a government that have certainly gone a long way to help us to slow down the spread of COVID. And Yvonne, we at least have the advantage of learning from other countries who have suffered COVID. We have seen the actions that different governments have taken and the outcomes. And that has informed a lot of what we have done, because some of the pronouncements that His Excellency the President has made, including having in place a curfew, ensuring that there's restricted movement in the high-risk counties, those are some of the moves that and measures that we have so far achieved as a country in terms of tackling COVID. And we have seen that countries that moved to take those actions quickly have been able to slow down and even eliminate COVID completely in their countries.
Okay.
We've also seen countries that took a bit of time and they are struggling with numbers rising. So far as a country, I think we have done well in terms of preparedness and trying to end the COVID.
Yeah, and you were talking about lessons learned. We've seen, what's happened in Italy, and we keep using that as a reference. But some would say closer home, a country like Ghana, which has some of the highest numbers, there might be something to learn from there. They've done over 44,000 tests. And, they put in place certain measures. And considering the fact that they had their first case on exactly the same day as we had here, and of course the issue of testing being quite important, could you talk to us about where we are with the testing, how many of those we can do now? Because this is obviously very key in the fight against COVID.
Yeah, yes, Ghana, of course, has taken its approach. We have taken some steps that cannot be ignored. The fact that we have been very hard on quarantine and made sure that that has been enforced. The fact that we have been having very aggressive contact tracing. All those are interventions that the Kenyan government has been able to take. We've also been testing, Yvonne, and to date, we have tested 8,000 people. And because our strategy has been to target the areas where we have the hotspots, really based on the contact tracing, and also focusing on the quarantine facilities where anyone who has been suspected with COVID has been staying. So that is what we have been doing. But as you heard the announcement and that was made by the Cabinet Secretary, Ministry of Health, together with His Excellency the President today, we will move to roll out to a more vigorous testing, increased testing in the very hotspot areas as we progressively move. And Yvonne, earlier on, we targeted one of the critical population of our people, that is the healthcare workers. That is a critical population to have started out with, and we are continuing to roll it out. So we are trying our best, but I must say that, Yvonne, this fight cannot be won just by the government taking these measures. This fight can only be won if every Kenyan adhered to all the guidelines and all the instructions that are issued. It's particularly about staying home so that we avoid the spread, making sure that we wear the masks when we are going out, and washing hands, Yvonne. So there is personal responsibility for us as citizens.
Yeah, just to get clarification on the testing that we have done, the President said today about 10,000 or slightly over 10,000 have been tested so far. We've also heard of the mass testing that was hampered by a delay in the testing reagents. Give us an update on where we are with the testing right now. How many will we be able to test tomorrow? What do you see as that projection regarding testing?
Yvonne, as things stand today, Kenya has ordered way over 200,000 test kits. But because of the disruption in the global market, these test kits come in small batches as they are found available. So that is a challenge that we are not only facing, but everybody else in the world is facing. So as things stand, yes, we have done just above 10,000 tests. We are able to do another 12,000 tests in the next few coming days, as we expect another batch of testing kits on Monday and in the days to come. So our capacity will continue to expand as the suppliers continue to onboard the testing kits to us. But I would say that in terms of testing, we do not have a gap. We have been able to take care of that. And it is well within our plan. So when we begin the mass testing, Yvonne, I can assure you that all the testing kits that are required will be in country.
There's now close to $1 billion, if not more, in the COVID fund. What are the priority areas as regards to spending this money? Where do you think it'll go to first? Where is it most needed?
I think first and foremost, it will one of the key priority areas is definitely, again, adding to the testing kits that we will require. Number two, the personal protective gears for our health workers. We must ensure that they are properly kitted. And remember, the government has already spent well over $1 billion so far to just make sure that we have been able to provide PPEs in the counties where COVID has emerged. And remember that at every county, we have already provided some minimum amounts of PPEs. And Yvonne, as I shared yesterday, if you understand the PPE, it is really the whole gearing or kitting of a health worker. So it means the overall, what they wear from that covers the head, the hooded overall. It means the goggles. It means the sterilized gloves. And yesterday, I attempted to put into context what that means for us as a country, because to kit a health worker, it costs us about 15,000 shillings to 20,000. And remember that in just one day, a COVID patient requires about 5 different workers around them wearing the kit. So you're looking at an average spend of 50, sometimes up to 100,000 shillings just to take care of one patient. So do the math, and that patient will be in hospital at an average of, say, 20 days. It shows you that the critical area where we require to have our investment made is in the PPEs. And we can also not ignore that the preventive side, which is what we must do to avoid sinking in more money into the PPEs, is what matters. Being able to produce masks and giving them to the citizenry so that people can all wear masks, and which is one of the things that we will be rolling out in line with what His Excellency directed today. But as that is coming, we also encourage citizens to use any innovation that is around them and clean piece of cloth to cover their noses and their mouths and to prevent the spread.
All right. The final one to you is, what do you see as the best and worst case scenarios in, say, the next month, in the next 6 months, in the next year? What are the best and worst case scenarios for you that you've projected?
The best case scenario, Yvonne, is when all of us adhere to the guidelines to stop the spread. To put it into context, corona is more infectious than any other disease that we have ever had. It is more infectious than HIV and AIDS. It is more infectious than the common cold. It is a highly contagious disease. And so the message that we keep saying that please stay at home so that we can break the cycle, and wear a mask and wash hands must be adhered to. So if we are to really observe the curfews and observe the restriction of movements, we'll be able to turn around the curve fairly quickly and bring down the numbers. Because the other problem, Yvonne, and what is the complication with COVID, is that it incubates in the population for 14 days. Mm-hmm. And you have heard that one person can actually contract up to between 4 and 30 people, but you will not see it. So because it's early days for us, we really must be proactive to take this up. And if you may allow me, Yvonne, the person who has best demonstrated what corona looks like is a clip that I've seen done by one of our artists, the comedian Omondi. I would encourage people to look at it, because that comedy clip he has done really demonstrates how contagious and dangerous corona is, because it moves quietly, but one day you will suddenly just start to see the symptoms exhibiting themselves. So these are early days, and our encouragement is to people, take it very seriously.
Yeah.
And Yvonne, if you'd allow me to give an example, a biblical example. In the early days when people had leprosy, before treatment, people used to be kept away from society for a while, and some would get well and come back, and some would not. Corona is equally the same. So quarantine should be embraced. When we come and discover that you perhaps are suspected to be having COVID, allow us to put you in quarantine. Number two, people should also not stigmatize corona. It is just another infectious disease.
Yeah.
So present for treatment. So that's best case, so we can turn around.
Okay.
But if we continue ignoring Yvonne, then we will see a big population of our people getting the infection, which of course the consequences are there for us to see from the rest of the world.
Dr. Moth talked about the 10,000, by the end of the month, and it was projected as 5,000 by around this time. Some specifics on what the worst case scenario for you at the Ministry of Health would be like. What would that look like specifically?
What I would tell you, Yvonne, is that the modelings that have been done by different institutions, most of them tend to give us different numbers. And this is also based on the fact that we also have to look at the uniqueness of our own population. And sometimes we are basing this modeling on, say, what has happened in another country, and yet sometimes the dynamics of the race, the genes of our people are different. But looking at what we have had in terms of worst case, it's already out there. We could easily hit 5,000 and easily hit 10,000, and it continues if we do not keenly follow the rules of quarantine for those that need to be quarantined, the rules of staying indoors and washing our hands and just allowing this disease to come to an end because we have stopped the transmission. Okay. So it could explode to exponential numbers if we do not take the measures that we are calling out for people to take.
All right, thank you very much for that. We'll have to leave it at that for now, but thank you very much for making the time for us this evening here tonight. Thank you, PS Susan Mochache in the Ministry of Health. Asante sana for speaking to us.